Revelations about workplace harassment have rocked Hollywood and Silicon Valley, but two Canadian doctors are saying it can't stop there. An editorial in the Canadian Medical Association Journal says in the era of Me Too, it is time for physicians to acknowledge that the medical profession is not immune to bullying, harassment, and discrimination. Dr. Sharon Straus is the director of the Knowledge Translation Program at the Lakeishing Knowledge Institute in Toronto and one of the editorial's co-authors. Thanks so much for being here, Doctor.
Thank you so much.
So to become a physician, you need to go through training. And a 2014 review from Resident Doctors of Canada found that up to 60% of residents experience sexual harassment during training. How much does the hierarchy that we see contribute to this problem of harassment?
Yes, it is a huge component of it because in medicine we have kind of a strange hierarchy where we start off as medical students and we're supervised by more senior residents and then by faculty. And we're dependent on them not just for our learning, but they complete evaluations of us and they also complete letters of reference for us so that helps us get into our subspecialties as we continue on our career path, helps us get jobs. And so there's very much this power imbalance that happens throughout our medical training.
Your entire success is dependent on what they think of you.
Exactly, absolutely. And so then you can imagine that if you're a medical student and you experience something or if you witness something, how likely is it going to be that you're going to feel comfortable stepping forward?
And how easy it is for an abuse of power to exist.
Absolutely, absolutely. And some of the research that we've done has shown that in academic medicine, we tolerate bad behavior in bright people. They get a pass for behaving badly if they're bright.
Because they're good at their job.
They're good at their job.
So does the effects of this harassment then trickle down to patients?
Absolutely. And this is one of the things that we have to be really concerned about because one of the great things about being a physician is that I get to work with patients and provide care for patients. But one of the things that we have to think about is that when there's bad behavior, it affects patient care. It affects the teams within which we work. It affects decision making. So you can imagine if you're seeing a patient and you want to consult from a subspecialist, and if you've maybe been bullied by them in the past, are you going to feel as comfortable making that phone call, asking them for a consult?
Or if you've experienced harassment during your workday and then you're dealing with a patient next, we know your frame of mind is going to be rattled at that point.
Absolutely. So it has a big impact on physician wellness. So it impacts depression, anxiety, people leave the profession, for example, and then ultimately patient care. And then the behavior gets role modeled for trainees as well.
So the harassment isn't purely sexual either. You wrote that when it comes to peer reviewing, silently observing unprofessional put-downs, verbal bullying directed towards colleagues, it sends the message that this kind of behavior is acceptable. What effect does this have on research within the medical field?
It's a great question, and one of the things that we worry about is, are people going to be as likely to collaborate? Because if you've experienced bullying or unprofessional behavior, people get bullied off of research grants, for example. They get threatened. People have their ideas stolen. So unfortunately, it's not a small problem. I'm not saying that it's a huge problem, but that it is something that we've seen. And we also have to think about then, how does that impact the productivity?
What changes can be made right now in the medical industry?
Yeah, so again, a great question. I think we have to focus on the organizational changes. We have to make a safe space for people to feel comfortable coming forward and making complaints. We have to have an explicit, transparent process for investigation. There has to be accountability. We can't tolerate bad behavior, and we have to make sure that there's consequences for people, that there's support for the victim, that if the perpetrator is found to be guilty, that they get remediation. So we have to make sure that we're explicit around this. And we also have to create allies.
Do you think the medical community is ready to talk about this?
I think that we are getting ready to talk about it. I think for so long we've had a culture of silence, and because of our small community in which we work, that I think people haven't felt comfortable talking about it. But certainly we're starting to hear stories coming out that people are really courageous in coming forward. But more so we're starting to see organizations wanting to address the culture.
Okay, well, it starts with one conversation, and we're glad we could have one here this morning. Dr. Straus, thank you.
Thank you very much.